Afternoon. I'm Peter Cower, Professor of Economics, and on behalf of Dr. Lynn Liddy, the Mac A. Rikard Chair of Business and Economics, it's my distinct pleasure to welcome you all to the Spring 2019 Rikard Lecture. Today we are very honored to have as our guest Donna W. Hyland, President and Chief Executive Officer of Children's Healthcare of Atlanta. For over 30 years, she has helped shape the delivery of quality healthcare to children in Georgia and beyond. Please allow me to say a few words about the Rikard Lecture Series before I introduce Donna Hyland. The series, established in 1991, is named for Mac A. Rikard, an Oglethorpe alumnus, Athletic Hall of Fame member, and former trustee. Mr. Rikard, who passed away in 1996, was the former president of Allied Products Company and was a lifelong supporter of Oglethorpe athletics and student scholarship. Donna Hyland, first as a chief financial officer, then as chief operating officer, and now as president and chief executive officer, has overseen monumental growth and achievement at Children's Healthcare of Atlanta. She was instrumental in mergers of Eagleston Children's Healthcare and Scottish Rite Children's Medical Center, as well as the addition of Hughes Spalding and Marcus Autism Center. These led to the formation of one of the nation's largest healthcare systems. Today, Children is constantly ranked as a top pediatric hospital, for instance, by U.S. News and World Report, and last month was named by Fortune magazine as one of the 100 best companies to work for. That was actually the 14th straight year it received that honor. Coincidentally, it was also the 14th consecutive year that Working Mother magazine named Children's as one of the 100 best companies for working mothers. These are only a few of the accolades that Children's Healthcare of Atlanta regularly receives. Donna Hyland's dedication to pediatric healthcare has resulted in her recognition as one of Atlanta's and Georgia's most influential leaders. Her dedication to the community extends well beyond children's healthcare. She serves on many boards, and I'll just name a few, including Atlanta Committee for Progress, Cousins Property Incorporated, Genuine Parts Company, Metro Atlanta Chamber of Commerce Executive Committee, and SunTrust. And you let it go away? But Children's is definitely staying. That's what she has been recently appointed by the First Lady, Sandra Deal, to serve Georgia Children's Cabinet. And while I have considerably more to say, I would now like to turn the podium over to our guest, Donna Hyland.
Thank you. So my first question was, do you all have to come to this? Thank you. Somebody said no. Well, welcome. And it's just such a pleasure to be here, and especially to see all the students here. And you're the future. And you're the people that we exist to take care of every day. You're a little over our age limit probably, but you know, kids are why Children's Healthcare exists. So I'll start by asking, how many people in the room have been, has anybody been a patient at Children's? Oh, there, one. Oh, two, back there, a few. Oh, a few of you, so good. So hopefully you know a little bit about Children's, but we are really proud of what we've been able to build in Atlanta. And as I thought about what to talk with you about today, so I was an accounting major in college, and nobody really talked to me very much about the importance of people. It was always about the numbers and about the financial statements, and it took me a while to learn just how important people are. So I thought I might share with you some of the lessons that I've learned, because guess what? You don't produce any number, you don't produce any results without people. Artificial intelligence has come a long way since I was in college, but it's still not the only thing that you need. You need people. And so that's what I'm going to talk to you about today, is leading a people-focused organization. Because when I think about the 11,000 employees that we have, the millions of children that we care for, it's the core, and it's the secret sauce. And so for all of you in your careers, I think really having that understanding and that appreciation will hopefully help you as you advance your careers. So we'll talk a little bit about people and kind of go through three different different things that I think are important. First is to talk about our mission. And I think every company, it's critically important that you understand what your mission is. It's particularly important for a place like us, and the values of the company, because that really then forms the culture, which is really the secret sauce. And I'll talk about that a little bit, and then the importance of strategy. And you all probably in your business classes have heard about that a little bit. So I'll try to bring it to life, and how important it is for us and what we do. Okay, I've already messed up the. Okay, so let's start with the mission of a place like Children's. It's pretty simple: to make kids better today and healthier tomorrow. And so we have to be ready every day for the several thousand kids that walk in our door. You never know what their condition is or what they're going to need. So we have to have this army of medical professionals that are ready to do whatever they need to do to care for the kids. And that's all about making kids better today. And it doesn't just happen, as you can imagine, in terms of all the myriad of different kinds of doctors and nurses and capabilities that we have to have ready. But the other thing is for kids. Think about if you can make kids healthier, then they're going to have long lives as healthy adults. And that's one of the things that we spend a lot of time focused on. And so we're looking at what are the things that can harm children that if you could help with prevention would make them healthier adults. A couple of things that I'll give you examples that we've tackled. One was childhood obesity. Georgia, actually, when we started this several years ago, was the highest. We were the second worst in the country in terms of childhood obesity. 38% of the kids in Georgia were either overweight or obese. And if you know, that can really create some long-term health issues. And so we really looked at what could we do. And what we found is that we needed to do a lot of education. We went to the schools, we partnered with the schools. We partnered with pediatricians. We partnered on both physical fitness and nutrition. And thankfully today, Georgia is now 19th worst. So we're still not where we need to be, but we've come a long way in terms of that. But more importantly, thinking about how many more kids are hopefully going to be on a path to being healthier as they grow older. The other thing we do around Healthier Tomorrow is research. So we partner with both Georgia Tech and Emory on a lot of research, both basic and bench research, as well as biomedical research, to look at how can you find those cures. And when you look at things like childhood cancer, I've been at Children's, you heard, for 30 years. Since I started at Children's, the cure rate for childhood cancer has gone from 25% to over 85% today. And that's because of research. And that's because there are 200 childhood cancer centers in this country that have come together. We put all of our data into it, and we're constantly looking at how do you learn from that and how do you translate that into the most cutting-edge treatments that are going to result in these types of outcomes. And I mean, that's pretty amazing to think about. You know, 30 years ago, if you had a diagnosis of cancer, you had a 25% chance of survival. Today, there are certain cancers that it's 90% cure rate. And so research is another core part of our mission in terms of Healthier Tomorrow. The other thing that I think is so important in any company, but particularly Children's, is our values. And these are our core values. It starts with caring about people. And that means we hire people. So when we're looking at who we're going to recruit to come to work at Children's, we actually screen for these values. Because we find that if you bring people into an organization that don't share these values, first of all, what happens is they can start to diminish the importance of these. But the other thing is the people that work there want them out, because they don't want to work with people that don't share their values. And so you see the first one here is care about people. We expect that people care about each other, that they care about certainly the patients that we care for. You have to care about their parents. And so you need to recruit the kind of people that really care deeply about other people. The second one, you would imagine, they have to be passionate about kids. We have doctors that are the most serious, smart, talented people imaginable that I've seen on the floor playing with a child just because that child may have needed that at that particular time. We have 14 facility dogs at Children's that everybody just absolutely loves. So you have to be, and that was an idea. We were the first children's hospital in the United States to allow facility dogs. Because you can imagine people are like, wait a minute, dogs, infection, ICUs, etc. But we worked through that. But that was because somebody was passionate about saying, how great would it be to have dogs to bring comfort to the children and families when we're here. So it's the kind of people that really love kids, they understand kids, and they want to do their best for them. And then the third is dedicated to better, constantly pushing ourselves to be better, because we think that every child deserves the kind of care that we provide. And we care for every child, regardless of their ability to pay. And that's one of the things that makes me so proud of Children's, because making sure that other children can have the same kind of care that I want for my kids is very important. And being part of an organization that does that is very inspirational for all of us. The third aspect that I'll mention that undergirds this is we put together our employee strategy. We actually made people a part of our strategy about 15 years ago now, because at that point, it was, there were a couple of things happening. A big shortage of healthcare workers. There still is today, by the way. Did you know that healthcare, I believe, is the top 5 out of the top 10 professions to go into in terms of demand is healthcare. So for all of you who are thinking about jobs, healthcare is a big field and one that is in high demand. But one of the things that we started with our people strategy is we went to our employees and we said, how could we become the kind of place that you would want to work over any other, and then a place that you would never want to leave? Tell us what it would take. And when we asked our employees that, we heard several themes that we've continued to refine over the years, which is why I think we've been on that Fortune 100 Best Place to Work. We didn't set out to get on that list. What we set out to do is be the kind of place that people would want to work. And what we asked our employees is, here's what do you need from us? And what we ask them in return is to make children a higher calling. Because we felt that if we took care of our employees and they made children a higher calling, then we would be the kind of place that a parent would want to bring their child, and we would be that kind of place that people would want to choose over all others. And here's what we've heard from our employees in terms of what's most important to them. Starting with they want the career they want. And what does that mean? That means that we're continually offering professional development for them, and that we're also providing them opportunities to move through different jobs. So I mentioned at Children's we have 11,000 different employees. We have lots of different jobs. So what we try to do is make sure that if you want to work in different parts of the organization, that we give you that opportunity. And that instead of you having to leave to go try a different job, you can actually stay in our organization, but you might be able to move from, so I started thinking about it, I started in accounting. I was the controller. And I've been able to move through a lot of different parts of Children's and have learned so much over the years in being able to do that. So a big part of our employee promise is providing that support. By the way, I tell my kids about this. I have a 22-year-old and a 26-year-old in terms of what they should be looking for in their employers, because I think professional development, developing you and continuing to invest in you, I hate to tell you, but when you finish here, that's really just the beginning. You're going to be learning every day of your life, I hope, because I think that's one of the things, for all of us. Another aspect was work I love. They said, make it easy to work here. Understand, what my day is like, and make sure that you're constantly aware and helpful with how do you create the kind of environment that I love to work in. Thank me, respect me, help me feel like it matters that I got up this morning and came to work. So we spend a lot of time and a lot of effort on recognition, on communication, and on removing barriers and hassles that just kind of drive everybody crazy. And that is a constant, as you can imagine, a constant set of work. Difference I make. And that's pretty easy at Children's because you get to save lives. You get to be part of really seeing what you do. But people want to feel that. And so they said, tell us the stories. Make sure that we're hearing about all the great things that Children's is doing. And I'm going to show you a couple of videos here that are just examples of the kinds of things that we do to help everybody continue to remember how important our work is. And then the fourth one is Life I Live. 80% of the employees at Children's are female, and we have a lot of working moms. So you heard about the working mothers. We have to really be attentive to that and thinking about how do you help people balance all the things you have to deal with in your life. And having kids, and in some cases it may be having an elderly parent that they're taking care of. We really try to provide services that can help people. We have a concierge service that can help you run errands and pick things up for you because we have so many people that, they leave work, they drive a long way to get to work, to get home, they just don't have time to do some of the things, and then you worry about it. And so that's examples of some of the types of things that we offer. And these are investments that the organization makes in our people, which goes back to if you're the place where people want to work and never leave, and in exchange for you feeling good about how you're taken care of, you make kids a higher calling. That's where we have people that just do extraordinary things to care for the children that we have the privilege of caring for every day. So I thought it might be interesting for you. This is business, not history, but Children's has a really rich history that I think it's worth you knowing about, because when you think about your own careers and what you're going to be doing, you just never know what that's going to culminate into years and years down the road. So this is the original Children's Healthcare. 2 rented bungalows in Decatur, Georgia. It was founded in September 1915 by a physician, Dr. Michael Hoke, who it was started as the Scottish Rite Convalescent Home for Crippled Children. And Dr. Hoke was an orthopedic surgeon who was able to help with club feet. And back then, kids, if there was any kind of issue, they really didn't have high quality health care. And Dr. Hoke founded this. It was funded, interestingly, by some Atlanta philanthropist women who would sell pencils on the streets in downtown Atlanta to raise money to support building this children's hospital. So they started these 2 rented bungalows. And a few years ago, we were celebrating our 100th anniversary, and we found a time capsule that had some information in it from the founding. And one of the things I thought was so fascinating, they found a quote from Dr. Hoke, who was the founder. And when he opened that in his address, he had said, "This little institution fills a long-needed want. I believe it will amount to a big thing eventually." Isn't that amazing? In 1915, and look at where we are today. And so I think there's a lesson in that for all of us in terms of you just never know what kind of impact you may be having with something you're doing, because he thought it was small back then, but look at what Children's has become today. We see over 1 million patient visits per year, children from all over Georgia and many other states, and it's one of the finest and largest children's hospitals in the United States. So all of that started from these little rented bungalows in Decatur. We have the 3 children's hospitals. So you have, some of you may know of these names. There's Scottish Rite Children's Hospital, which is on the north side of town. Eggleston, which is on the Emory campus. Hugh Spalding, which is downtown, right, close to Grady. We have the Marcus Autism Center, which is on Briarcliff. And then you see that we have a broad array of research partnerships. We are the teaching institution for the Emory School of Medicine and the Morehouse School of Medicine, so the medical students, all the pediatric residents and fellows are trained at Children's, and all of the medical students at Emory and Morehouse rotate through Children's for their pediatric rotations. We have urgent care locations, and you know, Metro Atlanta is very big, and so we have locations throughout that are providing care. The Center for Advanced Pediatrics, which some of you, if you get on 85, if you were to go down North Druid Hills and get on 85, you may see it. That's a new building that we just completed. And that brought together 7 different locations, and that's for kids with chronic and complex conditions. So we treat a lot of kids from all over the state and beyond. And these are families that would get up at 2 or 3 o'clock in the morning and drive to Atlanta and then have to go to like 5 different offices because their children need that many different subspecialists. We put all that in one location and totally coordinate that care so that those families can pull in, get everything they need there, to really try to relieve some of the burdens that they have for the medical conditions of their children. So, and you know, that's a good example of where our employees came together and said, this is something we need to really do a better job of caring for kids. And we were able to, you have to put together a business plan, you have to figure out how you're going to pay for that, and all the work to support that. You heard about, I talked a little bit about Fortune, working mothers, and I'm very proud that our nurses at both Eggleston and Scottish Rite, we were just awarded Magnet recognition, which is a recognition for the very best nurses in the country. Less than 8% of the hospitals have that, and both of our hospitals were just awarded that in the last few months. So if you know any nurses at Children's, be sure to congratulate them on that, because it really is a really, really big deal. So I talked about these values because that really is the core of where we start, that mission. So let's trail into strategy. So starting with that mission of making kids better today, healthier tomorrow, then we take our values, and then we work to develop our strategy. But I thought that instead of me just talking about what the children's culture is and the values and the types of people we hire, that it might be good for you to hear directly from some of our employees about what they think of about working at Children's.
When I think about Children's, I think about inspiration.
When I think about Children's, I think about love.
When I think about Children's, I think about compassion.
When I think of Children's, I think of families.
I call them colleagues, but I can also call them friends. Children's, you feel like you're going from one family to your next family. In December 2014, I lost my husband Sam to cystic fibrosis, and he was staying at a hospital across the street. Every single day between November 13th and December 2nd, I had coworkers calling me, texting me, coming to visit me at the hospital. I never in a million years thought that I would ever find such a supportive group of people to help me through such a difficult time. They're more than just coworkers. These people are my best friends and my family.
When I think about children, I think about happiness.
When I think of Children's, I think of family. When I think of Children's, I think of miracles.
One word for Children's: smiles. Passion. They just hire people who have a passion for doing what they do.
I think about dedication.
Marley is a 6-year-old little girl. I noticed that her hair started to fall out. I found a little girl who was sad, and I took a pair of scissors, and I decided to let Marley cut off all my hair for a donation. Afterwards, she took off her hat. First, she knew that it was okay to be bald because her nurse was also bald.
When I think of children's, I think of the best healthcare in the United States. I think of an industry leader.
I think children supports the work that we do and the work that I do every day by being really excited about the science that we're doing.
You get to be a part of making history. With some of the things that we do, you get to be a part of bringing in new, innovative therapies.
Children's is home.
This is my work family, and children's is home for me.
It enhances our best friend relationship.
I had an unexpected major surgery. The doorbell rang and she opened the door to allow the entire Children's Healthcare of Atlanta choir with potluck to share.
We look out for one another, and we take care of each other like family.
I couldn't imagine life without children.
We do it better than anybody else.
We enjoy what we do. We're fun-loving people, and we do a good job.
It's a place for healing.
Children need a place to come, and that's why we are here.
Children should be happy.
We are the professionals that get kids back to being kids and get back to running and playing.
Everyone shares the same story. You're at the grocery store wearing your children's t-shirt, and someone comes up to you and they tell you their own personal story. I know that I love putting on that children's t-shirt. I love showing to people that, look, I work for children's. I love being here and I don't want to work anywhere else.
How many of you would shave your head for one of your patients? All right. I mean, I think it's pretty amazing. And so those are the people that I had the privilege of leading, and as a result of that, that's why we have to work so hard to be the very best employer that we can and to take care of our employees, because those are some pretty special people there, and that's really what creates the culture and enables children's to continue to do so much of what we do. We have, a lot of programs. I thought I might share just a couple with you as examples, because whatever, again, you do in your careers, it's all about listening to your people, understanding what their needs are, and then you have to put together programs to support them. One of them that we have is for working moms, and one of the things that we recognized is we have a lot of young first-time moms that come to work at Children's, and we saw that their retention rate after they had their children, they were leaving the organization. So we had a very high turnover rate, and we needed to address that. And so one of the things we put together is a program called Great Expectations, and it's really having mentors for young mothers to help them with what are all the things you're going to be confronted with, how do we help you with daycare, how do we help you with all the issues that you have as a young mom and as a first-time mom. And what we saw is our retention rate for those first-time moms went from about 60% to almost 90% by just listening to them and offering that kind of help. And so, that's just been such a great success, because we spend a lot of effort. It's hard to find pediatric trained nurses. It's really hard to find pediatric cardiothoracic nurses that work in an intensive care unit or a pediatric intensive care unit. And so it's, you want to keep those talented people in the workforce and working for us. But in order to do that, we had to make it easy for them. We had to make it doable for them, and that, is one of the examples. The other thing that we do as executives is we round. We get out and we walk around and we listen and we talk to people about what's going on, and that is a really important thing. People need to get to see me and know me, that I'm not some picture, but a real person. And that's, another example. We spend a lot of time on communications. How do we make sure we're communicating what's going on at Children's? And that one of the great things about that is it's really changed our retention rates. We have some of the best retention rates in the country. And for every nurse that you lose, they tell you that if it's an intensive care nurse, it will cost you about a year's salary every time you turn one of those people off. So it has very high costs associated with that, in addition to finding another person. So this has had, all of these investments have had very significant positive ramifications for us. And it has a big business case behind it. It's the right thing to do, but all of you are going to work in business. You have to figure out how do you pay for all of this and how do you have a return on investment. So this is a great example of how that has played out for us. Our second value that I talked about was passionate about kids and how important it is to find the kind of people that really care deeply about children. One of the things we did is, again, we really wanted to understand what is it about people that work in a children's hospital that makes them so resilient. And what we found is that to work in a children's hospital, you have to be super strong. And so that was one of the things that we started to look for as we were hiring people, because you see really tough things in our environment. And I thought that another video that I would share with you is one of our doctors. Pediatric physicians are very special people, and sometimes you think about how do they do what they do every day, and also have just such an extraordinary commitment to patients. And I wanted to share with you one of my favorite stories of late, which is one of our doctors in the Aflac Cancer and Blood Disorders Center, Dr. Karen Wazalewski, and what she did for one of her patients to really just show how much she cared about her and her family.
People just derive so much inspiration and joy from watching Grace swim. I think we certainly have patients that impact us, and Grace is, certainly at the top of the list.
Nothing was going to stop her from swimming. It really was. It was, I think, a great escape. It was a way to stay ahead of her disease. Grace, every time she swam faster than the previous time she swam. As she got sicker, she got faster. She called it her happy place. It was in February of 2018.
Her 5K success. When she relapsed again, we knew it was incurable disease at that point.
She knew she wasn't going to be around for Swim Across America. We were in her hospital room, and that's when she said, "Will you swim for me?" She said, "Do you think anyone else will swim like, Dr. Wazalewski swims?" So we asked her, and her first response was, "No, I don't know how to swim." But then, of course, Dr. Wazalewski was in. She was like, I have to do this.
Yep. I didn't hesitate.
I don't know what else to say. That someone who cares. We would get up 3 times a week, skip the pool at 5 a.m. so that we could be ready to swim. And not really until our second to last practice did we realize this was Grace's lane.
Good morning, Swim Across Atlanta.
I don't know, it was just this mix of excitement. I felt like I was on the verge of crying.
So of course we're nervous, kind of apprehensive getting in the water. And we were going out to the turnabout, which is a second grade buoy. I noticed something else. I just got chills. Something else along the way. And it was a motorboat, and hanging from its canopy was a red umbrella with the words "Amazing Grace" written in white. And I said to Dr. Wazalewski, "Grace is here."
Obviously, you just felt Grace watching us, and she was there. Like when we finally get, finished and we're getting out of the water, I was just kind of completely overwhelmed with just joy and feeling Grace there, and really feeling, I think, how proud she was of everything that was kind of going on there.
She always thought of children's as, a place about hope and healing. And so really, it was really like we were there for a bigger cause, that there's this great dedicated group of professionals who are going to take care of their children as if they were their own. And that was always been our experience, and it was certainly our experience with Dr. Wasilewski.
I remember her smile and her bright blue eyes, and she wanted to live, and she did just that. Yeah.
Does anybody in here want to be a doctor? There's one back there. How would you like to have heard of your doctor? Pretty amazing, huh? She didn't know how to swim. She had asthma, and look at what she did to show respect for a very, very special patient. So when you talk about passionate about kids, those are the kind of folks that we look for. And then that last value, dedicated to better. One of the things that we've also tackled, so healthcare workers tend to be the most unhealthy because they give and they give and they give for everybody else, and they don't take care of themselves. And so one of the things that we did is we developed a program called Strong for Life. And it's a comprehensive program to help our own employees be healthier. And it has a myriad of different aspects to it, everything from exercise, nutrition. We do all kinds of fun contests. We try to make it easy for people to focus on their health. We do a lot of group activities, and it's really been one of the things I think that has changed our organization. And this is a group. So one of the things that we did is we had something called Try Possible. And this was for people that had never done a triathlon and never thought they could do a triathlon. And you'll see here that I think we had 145 people that signed up. We had trainers that helped them, and they participated in their first triathlon. So you can imagine how excited this group was working together. One of the other things, I mean, you saw the video of Dr. Wasilewski. We've had a real focus on physician wellness. The burnout rate for physicians in this country is very significant, so we wanted to work with our doctors. And we put together a number of different things around physician wellness, but one of them is a program for second victims, because often, physicians, they just keep moving through and they don't stop to take care of themselves and realize that they've been through a lot of stress with some of their patients. And we've been getting great feedback from our doctors about that program. So I wanted, I just thought today it would be helpful to maybe share with you some of the aspects of what it takes to be a people-focused organization and how important that is to really carry out your whatever your strategy may be as a company. And I think particularly for, I have such hope for the future of our country because of you all. You're socially conscious, you care, and I think you're going to be fantastic leaders of tomorrow. And as I thought about what I might be able to share with you, especially as business majors, I think understanding the importance of people and trying to keep that focus on people with wherever you may go in your careers is one thing that I wish somebody would have told me about sooner than they did, because it probably took me a lot of years to appreciate just how important that is. And I think it's the secret, no matter what business you're in. And so with that, I'm happy to answer questions, take any questions that anybody might have. I'm sure there's something. Yes, the first brave person.
Thank you. So there are many people, I would assume, that don't like the word profit in healthcare. So how would you talk to these people about helping them understand the role of profit in delivering healthcare?
Yeah.
Thank you.
Well, there's a saying called no margin, no mission. And so we have to make a quote unquote profit in order to be able to reinvest in the organization and do what we are able to do. And so that's how I would describe it to you. Our mission, so if you think about, and I can tell you, I worked for a for-profit company. That you have to, you have to deliver the shareholder value. Our shareholders are the community. So in healthcare, it's a little bit harder because there are a lot of businesses and a lot of programs that people bring to us that have losses. So it's all about how do you balance all that. Because I'll go back to, we care for all the kids that come to us regardless of their ability to pay. Our uncompensated care last year at cost was $134 million. So we have to figure out how we're going to cover that. So it's a constant juggling act to be able to manage all that, because you have a lot of things in healthcare that don't make money. You have to have some things that do in order to net out to have enough to continue to provide the capital for what you need. So I'm a big fan of tax exempt or not-for-profit healthcare, because I think you have to have a mission, and the reason you're given tax exempt status is so that you give back more than what you would have paid in taxes. And as a result of that, I think that's part of what has worked in this country as it relates to healthcare. Did that help? Yes.
So you mentioned that you screened for certain values in your employees. Mm-hmm. What exactly is your process for screening people? How do you determine those?
Well, because of our values, there's an electronic screening tool that our folks in HR have developed that helps. We get about 125,000 applications a year, so we can't, have somebody talk to all 125,000. So there's a tool, an electronic tool that does screening that was developed by some industrial psychologists. And then all of our interviewing and the way that we go through interviewing and the way we go through the selection process continues through that process to screen for those values. And I'm sure, one of the things that always worries me is, did we screen anybody out with that initial 125,000 that would have been great people at Children's? But when you get that many applications, you have to have some mechanism to help you manage that. Yes?
I'm Dan Shabler. I'm Professor Emeritus of Biology, and I was the Pre-Med and Health Career Advisor here. I like very much what you do for your doctors and your nurses and so on. But as a pre-med advisor, one of the things you face is lots of students who decide, I really don't want a job with patient contact. That's just not for me. As one of my former students said, I just can't stand sick people. So how many of your 11,000 employees, on the other hand, do not have direct patient contact, but work behind the scenes to make sure that your doctors and nurses and everybody else can work efficiently?
That's a great question, and I don't know for sure the answer to that off the top of my head, but I would say that probably there's probably 4,000 or so that are not direct, indirect patient care. And then of course in the fields of medicine you have researchers that is very valuable. Now most of our research staff are actually Emory or Georgia Tech faculty, but we have thousands of people that are working in research for children. So that's another part of healthcare that's very important, but doesn't have that direct patient care. We have a lot of IT people. We were just talking about that. I think we have about 500 people just in information technology that are supporting the delivery of what we do. Yes?
How do you maintain a good work-life balance with obviously being such a high kind of stress organization and an organization that's kind of running 24/7, 365?
Yeah, that's a great question. I think one of the things we learned is work-life balance is different for everybody, and really depending on what phase of life you're going through. So that's a lot of why we offer these various programs to try to help people with that. But I think for every I can speak for myself. What it took to have that work-life balance has changed many, many, many times during my career. And so I would say that to all of you. I think it's up to you to find that for yourself, but also if there's something that your employer can help you with, to go to that, but it's really got to be you that can figure that out. It's very doable. It's just, I think everybody's got to work it out for yourself. Yes?
You talked about how you focus on the physical health of your employees, making sure they don't burn out. Do you have any specific programs that address the emotional or the psychological toll of working in such a difficult industry with children and patients who will sometimes die?
Yeah, we do a lot of resiliency. We have people in our system that are trained in that, so we do a lot of work with resiliency, and we also have teams that can come in if we have a particular crisis that's happened anywhere in a department. We have teams of people, psychologists, social workers, chaplains, that will come in and actually work with those teams. And so we have programs such as that I think are very important. The emotional health and the mental health of our employees is critically important, and it's a hard place, can be a very hard place to work. So we need to bring in those experts and that support for them. Thank you. Yes.
Most of your work is political in terms of you're working with politicians to help in health care for all or health care for some, or your bottom line, whether it's for profit or not for profit, is very much dictated by who has health care and who has insurance and who doesn't.
Yeah, a tremendous amount. And we have a whole team of government relations people. But when you think about kids in this country, and in Georgia, most kids can get qualified for the program that's called Medicaid. Medicare is for 65 and over. Medicaid is for, it's income based. And so a big part of what we do is to protect that Medicaid program, because that's what provides health care for children. And we try to do everything we can to help get kids qualified for Medicaid, because even if they come into Children's, it's not just what happens at Children's, but once they get that, it's like an insurance card. So it helps them get eye care and dental care and many other aspects of health care that they may need. So protecting the Medicaid program is very important. And what's happened in Georgia, and it's really happened around the country, the Medicaid program was developed in the 60s for pregnant women and children. What's happened is the age blind and disabled is also now funded by Medicaid. And what we're seeing is that about 2/3 of the enrollees are kids, but it's about 20% of the cost is now going toward kids, because the age blind and disabled is taking a disproportionate share of that. So we spend a lot of time politically trying to protect the Medicaid program. And there are a myriad of other regulations and things that we also have to work on. But the most significant one is Medicaid, and making sure that that's protected for kids, because that's what really offers access to children in the United States. Yes?
When you were in college, did you know right away that Children's was a place that you wanted to be at long term, or was it when you got there?
Had no clue or intention. If you would have told me that I would have worked in healthcare, I would have said, nope. Or a children's hospital. So no, it just happened. Actually, I'm a CPA, so I was an accountant. I thought I wanted to be a tax lawyer. And so that's where I thought I would end up. So no. So I would tell you, be open to options and opportunities that come along, because some people are lucky enough maybe to know exactly what they want to do, but that certainly didn't happen with me. And I would have never thought I would have stayed at the same place for 30 years either. But here I am. All right, well, thank you all so much.